I'm here to talk on a very important topic on IVF. A lot of us know the meaning of IVF, in vitro fertilization, that is assisted reproductive technology, IVF. A lot of women all over the world are finding it difficult to get pregnant. A lot of women all over the world, they've done so many things to see if they can conceive, but no way. And you see their age, they are getting older and older. They have stayed for so many years without conception. So what is this in vitro fertilization IVF? It's a process of fertilizing the egg outside the womb using the healthy egg and the healthy sperm to fertilize it and then put it back to the woman's womb in order to continue its process. It's called IVF. So when will you consider IVF? When will you consider IVF? That is the topic of today. When will you consider IVF? Number one is unsuccessful attempt. When you have tried, maybe you have tried to conceive for so many years, more than 1 year or more, and the conception is not coming, and you have seen that your age is going, women, after 55 and above, menopause will set in. So if you are that high, another reason why you should consider IVF is for women, older women above 45, above 45 of age. You can consider IVF because women in that category have decreased egg and low quality egg. Their eggs no longer healthy enough to carry out normal baby, so they should consider IVF. The next people that may consider IVF are single mothers. There are some single mothers that may decide just to have children. They don't want to, they are not married, they just want to have their children, so they may consider IVF or surrogacy, what we call surrogacy. So another one is, before you should consider IVF, you should know that IVF is very, very costly. You should make sure that you have enough money for it, because it's not 1 naira. It's very, very exorbitant if you want to consider IVF. There are also conditions that may make you to consider IVF. There are some factors like unexplained infertility. There are some women that they have gone to their doctor to tell them that they are okay, both the husband and the wife, but get pregnant, no way. They are not conceiving. So such people may consider IVF. Other people that may consider IVF are people that normally have frequent miscarriages, frequent pregnancy loss. Every time if you conceive, you lost the baby. And for those people, they will consider what we call pre-implantation genetic testing. So in order to select a healthy egg that may be able to stay in your womb. So I want you to consider all these things before you could go for IVF. There are other alternatives. You should try other alternatives before considering IVF, like healthy lifestyle. Check your body weight, check your health issue, whether you have diabetes, whether you have endometriosis, whether you have conditions that you need to treat, and to check whether you'll be able to conceive naturally. You should also consider try fertility medicines in order to enhance your ovulation and your fertility, and then you try uterine insemination, that is IUI, to see if you can conceive. Then if you have tried all these things and you are not able to conceive, then you can try IVF. Thank you very much. I'm not that person than your friend Kina. Thank you.